It is 8:43. Can a depression drug keep you out of the hospital for COVID? A new study reports some surprising findings about the connection between several drugs, but one commonly known as Prozac and COVID. R9 health expert Dr. Pyle Coley joins us to talk about this further. So you say there's actually a couple of drugs that were in the study.
That's right, Gary. So Prozac or fluoxetine and then another drug called fluvoxamine sound very similar, both the same classes of drugs used commonly to treat depression or obsessive compulsive disease. And what they found is that people who got this drug and ended up in the hospital with COVID ended up doing better. So they did this trial called the Together trial, and they found that giving patients this drug for 10 days early after COVID onset keeps them out of the hospital and keeps them alive.
That's pretty interesting. Were you surprised by this? I mean, had you had any idea?
I was a little surprised because the mechanism of the drug is that it really works up in the brain and the central nervous system as a serotonin uptake inhibitor. But what we're thinking is that it may have anti-inflammatory effects. We also think it may have antiplatelet activity, so less likely to make blood clots, which we know is a complication of COVID. And then we think there may be a mechanism through melatonin by which it actually exerts its beneficial effect as well. So a little surprising to see such a dramatic reduction. 32% decrease in hospitalizations, 32% decrease in death.
And you were telling me that this might be a bargain because some of these other medications they're coming up with are pretty expensive.
That's right. I mean, $4 for a course of treatment with one of these medications versus $700 for those antiviral medicines we've been talking about from Merck and Pfizer versus $2,000 for the antibodies. So certainly another tool in our armamentarium, but maybe even a better tool if it works as well as the others and is much more inexpensive.
I'm guessing that as COVID goes on and more people are treated, they're going to find more and more stuff like this, you know, that they can count on.
Absolutely. And COVID, we've learned, is not just a respiratory virus, it's a systemic virus. So the fact that a depression drug works to treat the effects of COVID, I think we're going to see these types of associations on and on.
Pretty interesting stuff. All right, Dr. Coley, as always, nice to see you.
Nice to see you,
Thank
too.
you.